naga-RLE naman mo, duty na mo ana. Mapangutan-an gyud mo unsa may style ana ma'am. Wa gyud ni style, paningkamot paningtiil gyud ang style ana. Okay? Kailangan jud mo ano gyud mo. It's your will gyud. Ingon ani ang mahitabuan sa class. Kunyari, pag abot ninyo sa hospital, pabuhaton man jud mo og drug study ana. Okay? Pabuhaton jud mo og drug study kay syempre each patient has different medications in the hospital. Pabuhaton mo og drug study. Kunya pag drug study ninyo class kay pangutan-on mo sa inyong CI. Oh, what is the mechanism of action of this medication? What is this for? What is the signs and symptoms? What is the ingon ani? What is the ingon ana? Maingnan mo unya, dili mo makatubag, maingnan mo. Who is your pharma teacher? Oh. Patay ka, luoy na lang yun ni Mamara na unsaon na lang yun ni. Diba? Same ra pud na sa kung giingon sa akong estudyante sa ako ang tawag ani, sa ako ang anatomy. Akong giingnan na kung dili mo magtawag ani, kung dili ninyo i-take seriously ang ato ang concept or ang ato ang subject, pag abot ninyo on your higher level, mapangutan-an mo, it will always go back to me. Kay ako ang inyong instructor. Dili man sa si ma'am, pero unta ba, I try my best yun. I always try my best to deliver, okay, the subject na, kabalo dyan ko, ang pharma is very boring. Okay, very boring. Tapos, kung imong huna-hunaon, ma'am, unsa man dyan importante aning pharma sa ako ang, ma'am, sa akong trabaho. Because class, kung wala kay good ka ng background about sa pharma, okay, maglisod ka o sabot sa mga tambal later on. Okay, unsa ang mga pwede natong i-mix na tambal, unsa ang mga tambal na pwede mag-cause of nephrotoxicity, unsa ang pwedeng mga tambal sa mga patients with ESRD, unsa ang mga tambal na pwede sa ingon ani, ingon ana. So kung kanilang daan class dili ninyo masabtan. Okay? Unsaon na lang ninyo pagsabot sa mas komplikado pa, labaw na inig na anay disease process. Okay? And I tell you, it will be happening, okay? It will be happening by midterms or finals that these medications we are starting to talk about, okay, will blend with disease process. So, kung naay ingon ani nga sakit imong patient, ngano kaniman nga tambal ang ihatag, ngano man, unsa ang maghimong effect ani sa iyaha? What about the excretory factor? What about the metabolism? So, ingon ana na siya class. Okay? Itudlo na ko sa inyo ha, pero in the end, still dili ako ang dili na ko magaranti. Okay? Dili na ko magaranti na masabtan ninyo sa tanan. Kasi it should be a two-way process. I am teaching you the best way na ma-deliver na ko ang ato ang subject na dili kaayo siya lisod sabton, maskin lisod na kaayo, okay? I always find ways to make things easy yun para masabtan. Kay niagi po kung pagka-estudyante class, okay? Kung ano pa lang gani, kung pwede pa lang nako Bisayaon tanan, Bisayaon na lang yun nako para mas masabtan ko. Okay? So, on your end, you also have to study in advance na dili lang kay studyhan ako ni karon kay mao ni gi-discuss ni ma'am dili. You have to really double your effort kasi nga you will be exposed in the clinical practice. Okay? Ang uban gani sa inyo naga-duty na, maubitaw na. Ang uban sa inyo ha, pag sige nag-excuse ako, ma'am, dili ko kasulod, ma'am, kay nagpa-hepa ko, nagpaingon ani ko because you will be exposed in clinical areas. Okay? So much with that. Let's continue. Okay. So part of our pharmacokinetics is the distribution. Kanina, absorption, karon distribution. Okay, so when we say of distribution, this is the process by which the drug becomes available to body fluids and body tissues. So ano din ang mga factors that influence the drug distribution? Still, your blood flow, the affinity of the blood tissues, and your protein binding effect. Okay? So, This process is also important kay it will affect daw the overall drug effects from the active sites. For example, sa na ay infection ang imuhang, there is infection in your asaman, in your lower extremities. For example, sa may pinakaano naa kay ascending fasciitis, for example. Okay, this is a disease. Okay, and then you are given a certain antibiotic. Ngayon, okay, because there is now poor perfusion of blood and tissue, okay, instead na mapaspas, maskin unsa pa ka-potent ang imuhang tambal, okay, maskin unsa pa ka-complex ang tambal, okay, pero naay problem sa imuhang blood flow, okay, and sa production sa imuhang tawag ani tissue perfusion, okay, still dili maabot dito sa part kung asa okay. So dili gihapon nato magaranti na there will be what? There will be efficacy or greater efficacy of the medicines dito sa kung asa ba jud exactly the infection takes place. Okay? So part gihapon na siya sa ato ang absorption mo na it's interrelated, the absorption and the distribution of medicines. Okay? Maskin pag dili po, there is exception if you are giving it intravenously. Kasi like what I said, if intravenously, it will already mix, okay, into the blood. Maubitaw na pag severe na gyud ang infection sa tong patient, dili na nato na siya ginatagaan og oral meds or IM medication. Diretso na gyud ta systemic na gyud ang ato ang approach. Okay? So when we say of protein binding, okay, these are drugs that bind with specific protein components such as albumin and globulin. Okay, example of these medications are anticonvulsant. Okay, so more of our anticonvulsant or mga CNS medications natin contains what? Albumin, and our CV medications such as antidysrhythmic medications, this contains what? Globulins. Okay? So, when we say of protein binding also, it refers, okay, it refers to the degree to which the medication attaches to the protein in the blood. Okay? Drugs efficiency may be affected by the degree to which it binds. Okay, so the lesser the drug is bound for protein, the more effective it can diffuse with the cell. Remember ninyo tong mga eto di ay. So, there are medications that we call inactive and free drugs. Okay? So, inactive drugs, eto yung component of our medications or our drugs that does not give any pharmacological response. Mura ni siya og katong atong mga excipients. Okay? They do not cause any pharmacological response, but they are added, okay? They are added into the medicine or into the drugs kasi nga they could help in the structure, in the metabolism, or it could what? It could protect the drug itself na dapat ma-release yun siya, for example, sa GIT, na. And these free drugs, okay, when we say of free drugs, these are medicines that what? That causes now the pharmacological response. So dira nato kung kunyari sa atong pain reliever, okay? 'Di ba kung moinom ta og pain reliever, ang effect niya is makapawala siya og sakit na ato ang gibati. So mao na to siya ang free drug. Pero of course, there are medications that has excipients or additional components. Okay? So kato siya, kato mga inactive nato, asa na siya padulong? Asa na siya padulong, ma'am? Of course, it will be going together with our kanang tawag ani kanang kung oral siya, okay? Remember, 'di ba, sa ato ang digestive system, anything that we eat that is not digested or metabolized, Okay? It will go to our large intestine and it will become a feces. But if this is what? IV or IM or mga unsa pang other forms, okay? O si mahitabo, okay? They will be excreted, especially if this has water content, it will be what? Excreted through the urine. Okay? Mao na ang tung urine pod naapod tay acid o naapod tay base. And we will be discussing that one also at the end, lower part of this slide. Okay? So when two highly protein-bound medications are given concurrently, this results to drug toxicity. Okay? Kasi nga, two complex medications. Okay? Too complex. Dili two na number, kundi too much. Sobra. Okay? Sobra ng mga protein-bound medications will cause drug toxicity daw. Okay? There is too much free drug release in the circulation. Okay? So, diri na to mubalik tong ato ang lecture last time about, remember ninyo katong mga drug-to-drug interactions? So, eto na yun siya. Ano yung mga pwede at saka hindi pwede natin ipagsabay ng mga medicines. Okay? So when we say of blood-brain barrier or also known as BBB, okay, this is a highly selective semi-permeable, okay, border of composed of endothelial cells. Ma'am, na po yung anatomy. Maujud na siya. Nandiyan na siya yung anatomy. Okay? So, endothelial cells daw ning tawagan ni BBB. Covering daw ni siya sa atuang brain. Okay? It tightly regulates what? The movement of ions in and out of our blood and in our brain. Kasi nga, 'di ba, murag sa cells nato, 'di ba? Naatay plasma membrane, naapod tay nuclear membrane, 'di ba? Kasi nga they protect the internal structure of a certain organ or a certain part, ana. Okay? So, like what it is in the slide, it is a protective system of cellular activity that keeps foreign invaders or poisons away from CNS. Kung ang imuhang patient, okay, siguro nakadungog naman mo anak patients with encephalopathy or tawagan ni kanang encephalitis, I'm sorry, encephalitis o encephalopathy. Okay? So these are what? CNS problems because there is a problem or there is what? Altered blood and brain barriers. Okay? Nakapass through ang infection, okay? Or ang microbes dito sa BBB, mao na nagkaroon ta og infection sa brain. Okay? So, unsa lang ba ang mga makasulod daw sa BBB? Okay? Ang makapass through lang sa ato ang BBB is high lipid soluble drugs that are likely to pass. Okay? Likely to pass the BBB. So, what are these medications daw na kanang makapass daw sa ato ang, unsa daw ning mga medications daw na makapass daw sa ato ang BBB? Okay. For medications class medications such as propanolol, oxprenolol, metoprolol, mao daw na siya kanang mga timolol kanang mga ulol, mao lang daw na siya ang mga makapass daw sa ato ang BBB. Ngano man, okay? Because these substances can what? Easily diffuse. Okay? Can easily diffuse across the barrier. Kasi nga they are what? They are high in soluble, high lipid soluble medications. Okay? Aside pa sa kana nga mga medications, unsa pa ang makasulod anang BBB? Syempre, tubig. Okay? Tubig. Maliban sa tubig, pinaka-importante ang oxygen. Kay maskin asa man sigurong part sa tong lawas pag walay oxygen, kabalo na ta na the result will be what? There will be brain or tissue damage. Okay? So, ang antibiotics daw cannot pass with this BBB. Mo bitaw na, di ba? Katong akong giingon sa inyo, encephalitis, patients with encephalitis, okay? Daghang klaseng mga medications. Labaw na itong sa unang panahon, class. Okay, labaw na ito sa unang panahon. Ang mga patients na to na naay encephalitis, maskin pag halo-halo na ang ilahang medications or antibiotics sa ginatake, dili gid siya dayon-dayon magkaroon og effect. Magkaroon na lang yun ang imuhang pasyente og renal damage, wala pa na-treat ang infection sa iyahang brain. Kasi nga, our antibiotics cannot pass this BBB. Pero ma'am, di ba ingon ka, maubitaw siya nagkaroon og encephalitis kay damage ang iyang BBB. Yes, class. Damage yung BBB, mauna nakapass. But there are certain times, okay? There are certain times that, okay, medication such as antibiotic can pass, okay? Pero dili siya basta-basta. Kumbaga, murag niagi siya sa butas ng karayom bago siya nakapass. Okay? Ana. Tapos, kumbaga, mobitaw na akong giingon na, nagkaroon na lang siya og renal damage, wala pa na-treat ang iyahang infection sa brain. Kasi nga, really, our antibiotics cannot penetrate with this BBB and including in the blood CSF, kana sa cerebrospinal fluid nato, connected gyapon na siya sa CNS. Okay? Mao na ang mga tawag ani ang iyahang mga medications, okay? Regulated na lang siya. Tapos karon, because of technological advancement, daghan naman tag mga klaseng antibiotics, labaw na ang atong mga broad spectrum antibiotics, including good bacteria, mapatay pud anang mga broad spectrum antibiotics nato. Mao na we are also cautious in giving this kind of antibiotics yun. Okay? Kay dili lang kanang mga helpful na mga bacteria in our body ang ilahang maano, kundi tanan yun. Okay? Pag ingon ganing bacteria, tanan iyahang i-eradicate. Labaw na pag bactericidal siya. Okay? So there are medicines that can pass our placenta in breast milk. Okay? Drugs readily pass through the placenta and affect the developing fetus. Okay? Which causes what? Teratogenic effects, okay, malformations in the physical and the bone structures of the fetus while inside the womb of the mother. Okay, there are also medications that is secreted into the breast milk and therefore have potential effect to the neonate. So wala na, labaw na, di ba, ang mga tawag ani, ang mga mama, okay, labaw na sa unang panahon, pagbuntis sila or nagapainom sila og gatas sa ilahang anak through breast milk, okay, they really what? They really stop whatever maintenance medications they have. Okay, kasi nga, ang ilahang fear kay, basi maunsa akong anak, basi mainom sa akong anak ang gatas, nga naay tambal, daghan kaayo siya, which is actually true. Okay, because there are really medications and potent medications that could pass here in these barriers and could cause what? Malformations to the child, okay, or to the baby or to the fetus. So, unsa daw nato mabalaan kung ang isa ka tambal, okay, can pass or cannot pass, okay? If a certain drug's molecular weight is below 500 grams per molecule, okay, it could pass our placenta. Okay? Less than 500 grams daw per molecular weight, makapass yun daw na siya. If po the drugs, okay? If the drugs has a molecular value or molecular weight of 500 to 1,000 grams per molecular weight, okay? Makapass, pero dili basta-basta. Okay, it will take time. Kaya nga naman, dako naman siya og substance, dako na siya og molecule ba. Okay? And medications that has greater molecular weight, like 1,000 and above, mao na jud na ang dili makapass. Example are the complex antibiotics that we will be discussing later on. Okay? Sorry lang kay nag-message si Ma'am Lynn, si Ma'am Sokwana. Okay, sige. May question? Ay, oo. Oo, pwede. Sige, you may. So, next. Unsa daw tong, di ba, naka-mention ako sa inyo ha, sa unsa ang pwede og dili makasulod sa ato ang placenta o kanang breast milk barrier. So, these are the things you have to remember. Okay? Drugs that don't pass in our placenta but it is safe to use. Okay? Unsa daw ni siya? So, dili siya makapas sa placenta because the molecular weight of these medications are higher. Okay? So, since dili siya makapas sa placenta, safe to use siya sa mama. Okay, what are these medications? Remember the mnemonics, he is going nowhere soon. Unsa daw ang mga medications aning he is going nowhere soon? He is for heparin, is for insulin, going is for glycopyrrolate, nowhere is for NDNMB or non-depolarizing neuromuscular blockers, and soon or succinylcholine or succinylcholine. This ND, NMB, and succinylcholine, these are muscle relaxants, okay, that we are commonly using for anesthesia. Okay? Take note of that, class. Oh. Ma'am, mugawas na sa quiz. Huna-unsa na ako. Okay. Sige. Class, I will give you break. I will give you 10 minutes break. It's 2:35. Okay, para inat-inata usayang inyuhang mga brain cells po dira. Okay? Pag-ambak-ambak sa inyuhang mga gilingkuran. Luis, na okay pa ka dira? Mura nagnaunsa naman ang nahimo na makadrawing-drawing dira. Okay? So, I'll give you 10 minutes break. Take your snacks. Inom og kape para dili katulgon kay ma'am, grabe na, di na makaya. Okay, sige. We will be back by, unsa ba? 2:45. Sige. Okay, naka-energize na mo? Okay. Sige, balik ta. So there are medications, okay, kasi nga 'di ba sa unang panahon, okay, once our pregnant women or lactating women have certain diseases or di ka ng mga sakit, they cannot take medicines because they are afraid that these medicines could what? Could cause malformation sa baby, which is really true. Okay, it's really true that there are medications even up to now. It is still available na kanang naay mga teratogenic effects sa ato ang mga baby. But because of continuous research, okay, continuous research and kanang mga tests, okay, we have this what we call FDA pregnancy categories. Unsa ni siya, ma'am? Okay? For our patients, okay, patients who have what? Certain disorders, sabihin na lang natin kunyari, yung pinaka-simple, pinaka-common, mga diabetic patients, okay? Mga type 1, yung mga patients natin na merong mataas na blood pressure, hypertensive, or mga patients natin na merong mga hormonal therapies kasi nga there is mga thyroid problem, mga ganyan. So, yun sila na mga patients. Ngayon, pag nagbuntis daw sila, okay, paano yung mga gamot nila? Okay? So, treatment of common medical conditions during pregnancy became a complicated issue due to the potential effects nga of these medications daw on the fetal growth and development. So, the use of medicines during pregnancy has been declined. Okay, nagbaba na daw due to the risk of these fetal abnormalities. Ikaw daw ikaw mama, gusto ba ka na imong anak magkaroon og abnormalidad? Di ba dili? You will always want the best for your child. Okay? So, pero dahil nga sa advancement and continuous development of medicines, nabuo itong guideline na itong FDA pregnancy category for this is to give awareness and knowledge, okay, to fully understand the efficacy and the effectiveness of giving medications and the safety of these medications during pregnancy and lactation. Okay? Since, ma'am, kano saan ni siya na-establish, ma'am? Since 1970s pa, patagi panganak ani. Okay? Napata sa mga itlog sa atong mga amahan ani. Mga panahon na. Okay? So, since 1979, this FDA pregnancy is already used. Okay? Up to present. So, unsa daw ang pasabot ani, ma'am? When we say of category A medicines, okay, it shows no risk or evidence signs that it could cause fetal abnormalities, especially during the first trimester of pregnancy. Okay? So wala siya. These are safe to use medication, especially during first trimester. Okay? Unsa man ang naa sa first trimester nato? Kuhasan na idea, unsa ang nasa first trimester sa itong pregnancy. Okay, nakamerienda na ta ha. Sige. Stephanie. Steph?
Yes, ma'am.
Ano ang nasa first trimester daw ng ating pregnancy? Do you have any idea?
Wala ko idea, ma'am.
Okay, sige. Okay lang yan. Sige. What about CJ? Siege?
Po, ma'am. Hello po.
Hi, Siege. Okay, tanong lang ako, do you have any idea ano ang nasa first trimester natin ng pregnancy?
kuan pa siya, ma'am. Fetus pa siya.
Oh, fetus pa man jud na basta wala
Kanang
pa na.
dili pa maklakuan ng gender, ma'am ba? Nang gamay pa ba ang fetus?
Okay, gamay pa ang okay, kadali class ha. Pag fetus gani, fetus na siya pag napa na siya sa sulod sa tiyan. Okay? Pag napa siya sa sulod sa womb, it is fetus. Embryo po, ma'am. Okay. To be specific, thank you, Sige. Okay, thank you. Pero unsa ba ang nasa first trimester? During the first trimester, okay, fertilized ovum to a fetus. Dili, a fertilized ovum, di ba? Ang fertilized ovum mo to ang gina-release sa babae. Okay? Fertilized ovum ready for lahi. Garaan jud ko ninyo, ha? Karon ka. Naga-develop ang organs, ma'am, like heart, brains, chuchu. Very good. Okay? During the first trimester, this is what we call the state of organogenesis. Wherein, yes, okay? Formation pa muna tayo. Formation pa tayo ng vital organs ng ating fetus. Okay? Kaya yan, 0 to 13 weeks po ba ang possible na magkaroon ng miscarriage? Actually, class, pag sinabi ganin nating miscarriage, marami ding klaseng miscarriage. Meron tayong evitable, non-evitable, mga ganyan. Okay? Kasi kahit pa full term na, alam niyo yung ibig sabihin na full term, 38 weeks ready for delivery na, nagkakaroon pa rin tayo ng miscarriage, lalo na kapag inevitable abortion siya. Kasi talagang it could be mahina ang kapit ng fetus doon sa loob, tapos talagang may abnormality sa structure ang baby, pati ang mama. Meron din tayong certain instances na because it complicates the situation of the mom, okay, kaya kailangan natin i-expel ang fetus. Okay? Malalaman nyo yan lahat plus as you go to higher levels of nursing. Yan siya kasi pag sinabi kasi nating miscarriage, marami siyang forms of miscarriage. Okay? Hindi lang siya kay yung nasa organogenesis pa na 0 to 13 weeks. Pero yung 0 to 13 weeks natin na sinasabi, okay, yun yung pinaka-vital. Okay? Kasi nga doon yung organogenesis. Alam na natin kapag vital organs ang affected, okay, hindi na talaga, especially the heart and the brain, hindi na mag-continue mag-grow ang fetus sa loob. Okay? So yun yung ginaano na in category A, okay, medications are really what? Controlled during previous times. But ngayon, okay, because nga of continuous advancement and research, okay, category A medicines now are what? Good and safe to use for lactating and pregnant women. Okay? So first trimester, tandaan nyo yan. Pagdating nyo ng MCN, unsa ba ng first trimester? This is organogenesis. Okay? So when we say of category B, no risk evidence for human studies or animal studies. Okay? Pero, category B also is identified as wala pa siyang adequate studies. Kumbaga, continuous pa rin siya na ginapag-aralan. Okay? Merong iba nagsasabi that this is already safe to use, but syempre, we are dealing with life. Okay? So, may doubt pa kahit papaano. Okay? May doubt pa kahit papaano sa category B. Kaya, if you are going to choose between category A and B type of medications, okay, others will really prefer the category A kasi talagang it is tested and proven to be safe. Okay? What about category C? Risk cannot be ruled out. So uncertain pa. Okay? Kung kanina sa category B may doubt. Sa category C, hindi pa talaga natin ma-identify if this is safe to use or not. Okay? So yun lang yung tandaan. A is safe, B is doubt, C is on further studies pa. Okay? On further studies pa talaga siya kay cannot be ruled out pa man jud daw kung effective or kung safe ba or dili siya safe for nagamikon sa buntis. Category D, okay? This now shows what evident signs of fetal abnormalities. Okay? Daghan tag mga medications such as antibiotics. Okay? Antibiotics jud na. Kasi syempre, 'di ba? Ngano antibiotics man jud ng mga ingon anak ma'am kanang mga naay risk factor. Remember, we all started as cells. And our antibiotics could be bactericidal and bacteriostatic. So, makita sa kung nagatake ang ato ang mama or ang ato ang mga pregnant women og kanang mga og kanang antibiotics, they will see the formation of the fetus as what? As a foreign invader. Mao na nga iyahang inhibit ang cell production. So, mao na nang nahimong reason ngano nagkakaroon ta og kanang mga miscarriage kay mga wala ta kabalo nga buntis ta unya nagatake og mga tambal. Okay, na wala ta kabalo. Ang uban pod kung dili man ingon ana, they produce what? Abnormal uterine contractions that expel the fetus out of the womb. Okay? So daghan gyud dag mga medicines ana og mabalan na nato as we go along with the subject. Okay? And then category X, these are really medications proven that is not safe and cannot be used. Okay? For both pregnant and lactating women. Okay? So, unsa tong mga example nato, mga tawagan ni mga cancer meds. I remember during my time sa work nako sa Limso pa, we have this couple. Okay, we have this couple. Tapos ang iyahang wife is for elective cesarean section. Okay? Both dili man sila old. They are in their early 40s of age. And ang gina-conceive sa wife is what we call premium baby. When we say of premium baby, okay, premium siya kay kumbaga daghag process nagi-undergo ang mama para mag-conceive. Okay, sperm count, tapos tawag ani mga hormonal therapies para lang yun magkaroon sila og anak. And then late naman pud gud sila nagminyo, late na pud sila nag-anak. So premium baby ang term natin diyan. So ngayon, during her pregnancy, okay, 'di ba grabe na kay ilahang preparation kay gusto lagi magkaanak. Habang nagadako ang iyahang fetus, naapoy nagtubo nga kanang tumor sa iyahang matres. So, habang nagadako ang baby, nag-ilog sila sa nutrients sa tiyan sa mama. Okay? Karon, syempre premium baby og kana lang gud ang ilahang gianuhan. Dugay na na-answer na kumbaga dugay na nila giampuan. So, ang mama, okay, the wife really what? Pursued the pregnancy. So hantod sa pagka 38 week turning 38 weeks na. Okay, turning 38 weeks nagpa-CS na gyud siya. Tapos during sa cesarean section, syempre full term ang baby no. Full term. Tapos ipatanggal na pod niya ang iyahang matres. Nganuman because okay, di ba? Like what I said, ang baby og ang bukol sa iyang matres nagsabay og tubo. Kung tan-awon nimo iyahang tiyan, perting dako sa iyahang tiyan, pero iyahang baby kay mura lang kadako sa ganing unsa ganing kanang family size na Coke. Ingon ana ra yang baby, pero dako kayo siya tiyan. Kay nagdungan og tubo ang tumor og ang tawag ani ang baby sa iyahang tiyan. Dili kay gitagaan man siya option. Dagan siya option. You will continue the pregnancy or we will expel the child or the baby. So syempre ikaw gusto ba kapatyon imong anak, di ba dili? So you will always do your best. You will be choosing. Tapos ma-remember pa nako ang husband ato nga time is kanagay makita nato sa kanang palabas na papilion kung kinsa ang buhion, ang mama or ang baby. And it really happens, class. It really happens. Okay? Murag dili mo po siya 1 in a million, pero it really happens. Okay? Na kanang binimog sa palabas lang nimo pero naadi ay sa tinuod. Kana siya. So, mas ginapili nila na para dili ma-compromise ang health sa baby, bahalag ang ilahan na lang health ang mapag-iwanan, basta mabuhi lang ang ilahang anak. Okay? So, kana siya, but even this is existing, this FDA pregnancy categories, okay? Still, dili man gyud nato maiwasan na naadyoy uban na mas pilion na lang nila na di lang kumutik maskin unsa. Kumbaga mag-ano na lang daw sila. They will go on natural. Okay? Pharmacognosy. Sa man to. Itong mga herbal, di ba? Kalimutan na po ang pharmacognosy, murag last week ra to. Di ba? So, ingon ana ang ilahang mga belief pod sa uban. Okay? So, now we are in the metabolism. So, metabolism is also called or also termed as the biotransformation of medicines, okay, in our body. So, chemical changes of a substance undergoes in a body such as by the action of the enzyme. Remember niyo yung sinabi ko kanina, what is the certain enzyme, okay, that is necessary for metabolism? We call it cytochrome P450. Sulat ni ma'am ha. Kamot si ma'am og sulat. Cytochrome. P450. Okay? This particular enzyme is responsible for the biotransformation or metabolism of 70 to 80% of drugs in clinical use, sorry class. Okay? Mao daw ni siya ang substance, okay, or the enzyme responsible for metabolism. Okay? Raise ni ma'am. So drugs are being metabolized in both the gastrointestinal tract and liver as the primary site of metabolism. Okay? Most drugs are inactivated in our liver enzymes and are converted to water-soluble substances or yung ating mga inactive metabolites. Okay? That is for renal excretion. Ang sa ganitong mga inactive nato, those are what? Medications that does not give any pharmacological response. Okay? Inactive. Okay? O katong ato ang mga free. Okay? Free, mao na to ang nagabind sa ato ang mga proteins that causes what? That causes pharmacological response to a certain disease sa katawan ng tao. Okay? So, what are the factors that affect the the metabolism? Okay? Factors that affects metabolism is what? Genetic factor of a certain person. Kay nga naman ma'am, nga naman sir, naay uban tao na paspas ang metabolism. Mo bitaw na naay uban kana gatan-aw mo favorite kay ni nako class ba? Kana ganing si Hamzi, Korean na mukbang ay ganahan kay ko ana pero ma-amaze ko sa iya kay ngano man grabe kay siya mukaon pero ngano payat man siya, di ba? Samantalang ako nga ana jud ko ba grabe naman jud akong pugong-pugong sa kong kaon oy pero ngano sige mapugdako oy ngano sige maglingin akong naong ngano sige magkadako akong aping di ba? Wala nagyaga-yagaan na ni mama nga ko ang sarili ba kay para lang yun dili mo makatulog, no? So mo na siya class. Okay, because there are bitaw ma'am, nanong maupod ako pangutana, di po dyan po katubag ana. Kay kung kabalo lang po ko ana, wala na. Pero bitaw seriously class. Okay? So there are really people who are like that. Maskin siguro sa inyo ha. Diba? Naiuban dira sa inyo na pertigyod kapayat, pertigyod ganiti sa lawas pero pakauna, di ba, murag construction worker. O, diba? Grabe kay Shagpeg, makahurot yun siya og isa ka kanang kaldiruhan nga kanon. Pero kita nga nagpahipi-hipi, kita pa noon nagsigig kadako. That is because our genes are really what? Kanang pandagko gyud pang malakasan. Oh, masuya jud ko anang iba mamba. 5 lang ka spoon akong gikaon but dali ra mo taba. Sus kung taba na lang ka Jill, unsa na lang ko? Drum. Di ba? Di ba? Sus na lang ambot unsaon na lang. Samot na siguro inig magbuntis ko no basi dili lang ko murag drum basi mura na kong ilipanti kadako, di ba? So naagi na siya sa genetic factors gid na nato. Maybe because ang mama nato or atong papa kay tambok, ako kung mama gyud healthy gyud kayo siya. Dili ta mag-ingon og tambok sa tong mama kay magsakit ang heart sa tong mama. Ha, tambok ay kanang healthy lang. Okay? So ana, so genes ato ang mga parents kay ingon ana mauna nga dagko ay mauna nga naay uban sa tuat, taba naay uban is payat. Isa pa ka factor. Isa pa ka factor daw is what? The age. Okay? Remember ninyo katong sa ato ang discussion last time unsa ang pinaka mga vulnerable nato na mga age group, 'di ba? Ato ang elderly and our mga newborns or neonate. Kaya nga naman, syempre, kapag elderly naman gud ang atong patient, ang metabolism sa iyahang okay, ang iyahang liver, okay, cannot anymore produce, okay, enough enzymes that is used for what? For metabolism. Kanipod sa mga newborns pod, unsa pod ang sa newborns? Diba? Their liver is still immature to produce, okay? Required what? Required enzymes to metabolize certain mga medications that is strong and potent by concentration. What is another factor? Maliban sa genes, sa age, factor po na to is ato ang mga drug interactions. Drug interactions with food, okay? Drugs to drugs. Ano siya? Kasi nga, there are medicines that can really what? Can reduce the absorption and metabolism once they are taken together with food and the said medication. Na po, di ba? Remember ninyo itong mga synergistic effect, katong mga ingon ata, itong last nato na subject, ay last nato na meeting, di ba? So, unsa pod to na ang isa kay maka-inactivate sa effect sa isa katambal. Okay? So, yun yung mga factors that we have to consider in the metabolism as well. So, if our patient has this liver cirrhosis or hepatitis, it is really expected that this kind of patients will have difficulty in what? Metabolizing certain medications, even food. Okay? Dili lang kay medicines, but including the food. Kasi nga, their livers are not anymore functioning well. Okay? Kaya yan na there is impairment in metabolism. Okay? For patients with liver cirrhosis. So, kung kabalo ka na your patient is having kanang liver problems or hepatic problems, whether it is cirrhosis or kanang hepatitis or kung unsa pa mang klaseng mga hepatoliver disease di ara, tanawon jud nimo, am I still safe giving medication to my patient? Kabalo ko na imuha pa yung pasyente kay tagaan nimo tig 2 grams ug kanang mga heavy kay nga antibiotics sabayan pag yun nimo og mga calcium, mga kung unsa-unsa pa dira, di ba? Unya nagtuo ka nga makapabuhi ug makapa-extend na sa life sa imong patient, masigi padali ra nimo ang imong patient dito sa finish line, di ba? So imuha jud siyang tan-awon. Know your patient, know the history of your patient like what we have been discussing, okay? And know what is the function or what is the action of certain medications para sa treatment sa imuhang patient. Para tan-awon nimo ma-evaluate nimo kay kita man jud nurses ang naka-on hand yun, makakita na ang order ni doc ba kay kanang dili man sa kanang wa ko'y salig ha, pero ang patient nako na may kanang liver condition nga ingon ani pa man pwede man gud na nato i-address. Dok, clarify lang ko dok ba tama ni akong pagkasabot dok mao ni ang ihakan natambal sa tong patient di ba taas naman ang iyang BUN dok di ba sa paman mga problema dok di ba kanang naamatay ka ng liver problem ngano ingon ani kanang mangutana lang kung ano ingon ani ang ato ang tambal dok. Give yourself what? Give yourself give the doctors pala your doctors the kanang time or to reflect ba with your help as nurses to evaluate the effectivity of the therapies to our patient. Okay? So, maliban sa mga kaning mga factors, sakit sa patient, kanang pre-existing condition sa atong patient, mga absorption sa ato ang lawas and everything, factor din ang what? Ang half-life. Kasi half-life, ma'am, half-life ng gamot. Okay? Factor ni siya sa metabolism. Ngano man, ma'am, unsa man ning half-life? Half-life is the time it takes for the drug concentration to be eliminated. Okay? It is used, okay, ginagamit daw ni siya para guide sa atua as to unsa kadugayon nato tagaan as to unsa kadugayon daw ang kaning tambala, okay, mawala ang effect sa katawan ng tao. Okay? Tapos pag nawala na siya sa kumbaga sa sistema sa tao, okay? That's the time that we are going to administer another dose of medication. So our half-life, okay, is also an indication as to when we are going to give the next dose of our patients. Okay. For example daw, for a certain medications orally, okay, orally given, okay, in 20 milligrams, okay, kana nasa screen, in 20 milligrams by dose, okay, or by preparation, okay. After 2 hours, okay, after 2 hours, after the medication has reached its peak, okay, its peak, now the potency of this medication turned into half. So, ang effectivity daw sa kaninga tambal, gikan sa 100% after 2 hours, nahimo na lang siyang 50%. Okay? Kaya nga naman, because most of it is being what? Is already absorbed, or it could be part of it is already starting to become what? Excreted through urine. Okay? Diba? Kasi these medications can be converted man din into what? Fluids, 'di ba? Kung dili siya na fecal but in a fluids also. Tapos another 4 hours na po from the time that this medication has been ingested. 'Di ba? Nahimo na lang siyang 5 milligrams. So ang potency na lang, okay, sa kaninga tambal sa lawas, sa bloodstream nato is only 25%. Okay? Pababa siya every after 2 hours from the time that this medication reach its peak. Okay? Unsa nang peak, ma'am? Sige lang. Ato nang i-discuss dito sa lower part pa dyan sa atong slide. Unsa nang pasabotan ng peak? Peak, mao jud na dira nato makita ang kanang efficacy yun. Okay? Therapeutic effect of our medications in the body. Okay? That is the peak. Okay? For example, to be more specific, okay, if a patient is receiving aspirin or acetylsalicylic acid, okay, we all know that this aspirin, okay, is what? An anti-inflammatory drugs, or we also call this one as NSAIDs, non-steroidal anti-inflammatory drugs. Okay, this is used for pain reliever, or for kanang mga swellings brought about by arthritis, and it could also treat what? Fever. Okay? So, for healthy individuals, the low dose, okay, of an enteric-coated, katong murag na gani kanang form sa nips, Eminem, kanang iyang outer covering, mao nay pasabot sa enteric-coated, kaya basig nakalimot. Okay? The low-dose enteric-coated medication of aspirin reaches the peak plasma concentration within 3 to 4 hours after it is ingested. Okay? So 3 to 4 hours daw from the time that we have ingested our aspirin, dara daw nato makita ang peak sa therapeutic effect sa aspirin. So karon, kunyari, alas 2, niinom ko og aspirin, alas 2. Hulat ko og after 3 hours. After 3 hours, that is 5. Okay? At 5 in the afternoon, I will be expecting, okay, the first half-life of our aspirin. Unsa nay nahitabo from 650 milligrams na potency or kanang concentration, okay, concentration of aspirin, nahimo na lang siyang 325. Katunga, okay, katunga na lang sa katong original dose ang nabilin sa ako ang lawas. Okay? Okay. Basi ang uban, absorb na, ang uban, nagawas na nako, naihi na nako. Kay remember, class, okay, a normal individual urinates at least 20 ml every hour. Okay? So, there is consistent what? Excretion of fluids. Okay? Kay normal individual man gihapon ko, maskin PWD si ma'am, normal gihapon ko. Okay? So next, on my second half-life, that is after 6 hours, after the time I have ingested the aspirin. Okay? Nahimo na lang 25%. Okay? Ang dose sa aspirin sa ako ang lawas. That makes 162 milligrams. Okay? And then, after 9 hours pa yun, okay, after 9 hours pa yun, nabawasan na lang, nahimo na lang, quarter na lang yun sa dose sa aspirin na bilin sa ako ang lawas. And so on and so forth. So, karon maghuna-huna ko. After 18 hours, okay, after 18 hours, unsa nay mahitabo sa aspirin? Wala na siya. Dili na siya effective. It could be, pwede na pod magkaroon og remission sa imong fever, mubalik na pod ang kasakit sa imong tiil or sa imong tuhod brought by arthritis, or unsa ba? Unsa pa ba ilain? Aspirin also can be an anticoagulant, di ba? It's used also as an anticoagulant. So, pwede na ka magkaroon og kanang bunog-bunog ana sa aspirin, 'di ba? So, mao na siya ang half-life. It will help us determine as to when are we going to give the next dose of our medications to our patients. Okay? So, we hapit na ta mahuman. Ay, ma'am, paspasa, ma'am, paspasa. Sige, paspaso ni ma'am. Okay, excretion. We are on the last phase now of our pharmacokinetics. Again, pharmacokinetics, absorption, distribution, metabolism or biotransformation, and excretion. Okay? So when we say of excretion, this is the process of what? Of eliminating substances by body organs or tissues. Okay? This is part of our natural metabolic activity. Okay? What is the main route for elimination? We all know that it is our kidney. Kasi our kidney is the one that what? Filters all fluids. Okay? That goes inside our body. Okay? So, unsa pod ang other ways and forms of excretion? It could be by bile, feces, lungs, kanang sa the air that we breathe. There are also substances or molecules that go out as we breathe. Okay? In the salivary gland, in the sweat glands, and including in the breast milk. Okay? So, eto ngayon, yung urine pH natin. Okay? Our urine pH, okay, indicates what? The drug's excretion level. For example, Okay? Pag kana gani, di ba, pag nagapa-urinalysis ta, di ba, na ay nakabutang dira kanang pila ang specific gravity, ana-ana, naapod tayo kanang test for acid base of our urine. Okay? If our urine is very acidic, okay, and then we are taking medications, okay, daghan kitag medications, kinaga-maintenance na ta. Those medicines that is being excreted if our urine is very acidic are base medication. Unsa man ang mga base medication, ma'am? Kana tong mga tambal nga dili isog. In other terms, dili isog na mga tambal. Ma'am, abi ba nako acid isog unya karon base? Mao gyud na siya, kabaliktaran na siya, class. Okay? Kabaliktaran siya. Okay? Because of too much basic, okay, components that we excrete, our urine becomes acidic. Okay? And kung alkaline pod kaayo or basic pod kaayo ang imuhang ihi, it means you are excreting what? More of the acid or the toxic drugs. Okay? So, baliktad ha, acid imuhang iihi, pasabot, imong ginagawas nga tambal, base. Kung basic imong ihi, imong ginagawas is puro acid or toxic drugs. Okay? I hope dili na ninyo makalimtan. Ha? Please lang. Okay, so we are now in the summary of pharmacokinetics. Okay, to simplify it, pharmacokinetics is the movement, okay, the movement of medications in our body through the process of ADME. ADME, the absorption, distribution, metabolism, and excretion. Pharmacodynamics. Unsa po ning pharmacodynamics, ma'am? Sige lang. We will discuss what is pharmacodynamics pagkasunod. Okay? So, after we have ingested now a certain medication orally, okay, from the site of administration, it will be absorption starts to work. Okay? So, absorption, tapos it will be distributed, okay, distributed by our blood, okay, all throughout the system, especially doon sa site kung saan merong infiltration of infection, and then it will be metabolized, okay? It will be metabolized with the presence of certain enzymes, which is the cytochrome P40, okay? That is produced also, okay? And then it will be eliminated. Those medicines or those drugs that is not absorbed, okay, will be excreted. And it will be in a form of urine, feces, or in the bile. Okay? So what is pharmacodynamic? Okay, pharmacodynamic means, okay, this is the study of drug concentration and its effect on the body. Kung kanina, yung paano gumagalaw ang gamot, okay, or paano nadidistribute ang gamot sa ating katawan. Ngayon, yung mismo pag-aaralan natin, yung gamot na mismo at kung ano ang magiging effect nito sa katawan ng tao. Okay? The response of the medication. Okay? The primary effect, okay, is the desirable, and the secondary effect is the desirable and undesirable. So example, if a patient is taking antihistamine, example, diphenhydramine, specific name or the brand name is Benadryl. Okay? So what is this for? Our antihistamine is used to treat for allergies. Okay? Pero after effect niya or side effect sa ato ang Benadryl, okay, is what? It could cause CNS depression or drowsiness. Okay? Ma'am, unsa nang tawag ani? Unsa nang secondary effect? Is it good or is it bad? It could be good, it could be bad. Okay? Kasi katulad niyan, it causes a drowsy effect. It is good if you are going to take the antihistamine at bedtime kasi it could induce sleep. It can make you sleep well. Okay? But Okay? But if you are going to take this Benadryl, okay, during daytime, it becomes bad kasi nga, lalo na kapag ikaw ay nagadrive. Kasi it causes drowsy effect. So, basi madisgrasya ka. Diba? So, other example of this, ang pinaka-famous na glutathione. Diba? Daghan kay mga babae, sige, yung gamit og glutathione na injection. Nga naman, kay gusto sila mahimong tawag ani ka ng artista feels na skin. Glowing skin daw, kintahay. O, di ba? So, unsay ginabuhat, magpaturok o IV o kanang glutathione drip. Kay para makapagwapo o makapahamish daw sa skin. Kanang pinkish-pinkish daw nga effect. O sige, bahala ka, imo man ang choice. Okay? We all know that our glutathione is helpful for the liver. Okay? It could help what? Enhance our liver synthesis. But as an effect of this, side effect niya, it will block the melanocyte production. Mauna nga namuti ka. Okay? So, mauto siya. So, that is a desirable effect. Okay? Ang undesirable kay kanang magkaroon ta og kanang inom ka og paracetamol unya magka-EPS ka o kana dili na nato makontrol because these are already kumbaga embedded na siya sa kana nga tambal na. There are people that are sensitive to certain medications yun. Okay? So, pharmacodynamic phase has this receptor theory. Okay, what is this receptor theory? This is the drugs act through receptors by binding the receptor to produce or initiate a response or to block or prevent a response. This is the agonist and antagonist medications. Okay, agonist, these are medications that initiate a response. Okay, it could help what yung mga beta blockers natin, yung mga ganyan. Okay, papababa sa blood pressure, pampa-counteract sa mga cholesterol, yun yung ating mga tawag nito, yung mga naga-prevent. Okay? So drug actions replace or act, the drug actions of this receptor theory, it may replace or act as a substitute for a missing chemical. It could increase or stimulate certain cellular activities. Okay, it could also depress or slower cellular activities, or it could interfere. Okay, it could interfere with the functioning of foreign cells such as invading microorganisms. So, alamin natin yan. Okay? So, in pharmacodynamics, okay, kung kanina, sa pharmacokinetics, we had ADME. In pharmacodynamics, we have what we call onset, peak, and duration. Okay? OPD. Okay? ADME, pharmacokinetics, OPD, we have for pharmacodynamics. Unsa ning OPD, ma'am? The onset of action, okay? The peak of action, and the duration of action of medicines in the body. Okay. When we say onset, this pertains to how quick the medication will work. Okay? It takes time to reach the minimum effect concentration after the drug is being administered. Okay? So, di ba na atay ubang kanang patients or maskin kita usahay na inig magsakit ganitong ulo, dugayan ni epekto sa paracetamol, uy, dungaga na lang na ako di para mas paspas ang effect. No. Okay? Kaya dili man na siya bato ni Darna na inig tawagan imog tumor nimo inig syagit kog Darna na ka. Diba? Dili man, it goes in a process kasi nga, diba? We have to consider the what? The absorption. Okay? The absorption, the metabolism, the distribution. Anak pa, daghan pa kay proseso. Okay? Para makita nato ang effect sa kaninga tambal sa atong lawas. What is the peak of action? The peak of action is the medication. Okay, the medication per se reaches its what? Maximum effectiveness. Dara nato makita na, ay, nawala na yun makasakit sa ulo, na-epekto na yun siya. Ana, we can feel relief of a certain condition. Okay, relief from a certain condition na ato ang gibati. Okay? The peak of action, this is the condition that occurs when the drug reaches its highest blood or blood plasma concentration. Okay? Yun yung pinaka height ng effectivity ng gamot. Sabihin natin, it could be after 4 hours, okay? 4 hours, 6 hours, ganyan. Okay? When we say of duration of action, this pertains to how long the pain reliever, okay, or the effect of this pain reliever will last to the body. For example, after 8 hours, okay, after 8 hours, saka pa ko naka-feel balik na mabusakit akong ulo, uy. Oh, kana. So, from the time of administration or ingestion up to 8 hours, that is what we call the duration of action of your medicine. Okay? It is the length of time the drug has its pharmacological effect. Okay? Example. Sige ma'am, example ma'am. Aspirin na lang para mas dali na to siya maano. Aspirin magula kung nasugdan og example ba. Aspirin na lang sa huna-huna per minute. Okay? Okay, so ang aspirin, okay? Our aspirin has the onset of at least 20 to 30 minutes. Okay? Depending sa katong mga related factors, 'di ba? If you can still remember. Okay? So, maximum time 30 minutes for the onset. Okay? After you have taken it. The peak of action for this what? For this aspirin, okay? You will expect that your aspirin after 20 minutes, okay? After 20 minutes, maka-feel na ka medyo na okay naman po. Okay? Until what? Until such time, okay? Until usually our aspirin will have effect of 18 hours. Okay? Na nandiyan ang effect niya, na walay remissions of pain, inflammation, ana. Pero there are people who are continuously using aspirin kasi nga, 'di ba? This is an NSAID, labaw na ka ng mga mga arthritis na to, mga patients na of course we don't want them to have remissions, okay, or recurrence sa sakit na ilang iba. Sakit gud na siya, class. I myself, I know how it feels kay napod ko yung arthritis, okay? I have gouty arthritis, and pag muatake gyud ang ako ang gout, okay, maskin dili ko tigkaon og red meat, okay, kay dili man ko palakaon og baka, dili kay ko palakaon og kanang laman loob sa miskin unsa, okay? But I genetically acquired that from my father. Mo na nga pag mo atake gyud na siya, dili gyud kalihok ako ang kamot isa kasakit. Okay? And if we have patients like that, dili man jud nato gusto na mag-suffer ako ang patients, di ba? That's why we give them intervals o at least after 12 hours una usahay BID ang order kay dili na nato hulaton nga mag-totally wear off ang effect sa ato ang NSAIDs. Okay, we are going to administer them at their lowest rate na yun. Gikan tong, if you're going to remember the half-life, so dara na to mabalan. Muna, with the half-life, we will be able to identify when will be our next dosing of medications to our patients. Okay? Dara na nato makita, pila na lang ang percentage sa kanang drug component sa ato ang lawas. Okay? But for a certain tawag ani aspirin with continuous medication or continuous ingestion, okay? So sige tag-inom og aspirin as one of our kanang medications, okay? Ang kaning aspirin, it will totally what? It will totally subside sa system or sa body ng tao up to 10 days. Ingon anak kadugay. Okay, ang duration sa action sa ato ang aspirin. Mao na kunyari nag-stop kog take aspirin karon after 3 days of continuously taking it. Okay? After 10 days pa, okay, kung i-check na siya sa blood chem, okay, or kanang magpa-test ko sa kanang presence of aspirin sa lawas, okay? mawala lang na siya class after 10 days pa. Ingon anak kadugay. Okay? So, eto yun siya class. Okay? From the time of drug administration, okay, we will be able to wait for the process until what? A certain medication takes its peak. Okay? Ma-feel na to dara tong effectivity sa ato ang mga tambal na gitake dire sa peak. Okay? And it belongs now to the therapeutic concentration. Okay? Therapeutic concentration of your medicines. Okay? We don't what? We don't give our patients medicines, especially if it will go to the toxic. Kasi nga, alam na natin na it could cause nephrotoxicity. Okay? So, we always bound our treatment sa minimum to its therapeutic levels only. Okay? Once the medication reach its peak, okay? Kasi nga, di ba, half-life na, it will start to descend. Okay? Descend. And then what? During the descent of our what? Of our medications, okay? The medications will also start to wear off its effect in the system until we reach the what? Excretion and total what? Yung pag-eradicate na sa katawan ng tao. Okay? So, meron tayong tinatawag na therapeutic index. Ano daw tong therapeutic index, ma'am? This measures the margin, okay, of safety for a drugs to be used. Meron tayong low therapeutic index and high therapeutic index. Okay? So, pag sinabing low, narrow margin of safety, and when we say high, it is a wide margin of safety. So, take note of this. The closer the ratio, okay, the closer the ratio of a medication to 1, okay, pag mas dool daw ang therapeutic index sa isa katambal sa 1, okay, the higher or the greater the danger of toxicity it contributes. Okay? Pag dool sa 1 ang iyang therapeutic index, mas taas ang toxic effect sa katawan ng tao nito na gamot. Okay, how are you going to compute for your therapeutic index? The formula is here. So, therapeutic index over the toxic dose of a medicine over the effective dose of the medicine. Ma'am, unsa ng 50-50? That is standard. Okay? Timan-ani mo, therapeutic dose over, toxic dose over the effective dose. So, example, the therapeutic window of a digoxin, okay, is 0.8 to 2 nanogram per ml. Who can give me, okay, the therapeutic index of this digoxin? Sige. John Christopher. John. Hala, natulog ni si John Christopher. John? Ma'am, naka-on mic ko. 0.3. 0.3. It's not 0.3. Pero duol na. Wala ako marinig. Wala ako narinig. Wala, hindi ka narinig, John. Sige. Melanie. Thank you, John. Okay, Melanie. How did you compute for that, Mel? Cabriadas? Melanie? 0.8 divided by 2.4. Hindi siya 2.4 lang ging. It's 2 only. Ito yung therapeutic level natin. Okay? Kasi if greater than 2.4 daw po, okay, ang ating digoxin, it could cause hypokalemia, hypomagnesia, and arrhythmia. Ito lang yung binigay ko. So, 0.8, pero tama yung ginawa mong formula. Tama yun. Okay? We divided 0.8 to okay, and the result will be 0.4. Kaya, di ba, 0.4, 0.4. 0.8 divided by 2. 2.0 is 0.4. Okay? Sige. So, since ang ating 'di ba, the closer the therapeutic index to 1, okay, the more it becomes toxic. Kaya etong digoxin natin, class, okay, we really give this with caution. Okay? With caution kasi nga this is highly toxic. Okay? Lower than this range may not have a desired therapeutic effect. And kung sobra naman, like more than 2.4 ang iyong digoxin level, okay, magkukos yan ng hypokalemia. Okay, hypokalemia, hypomagnesia, magnesia, and arrhythmia. These are all cardiovascular disorders. Okay, cardiovascular problems. Okay, so pwede mag-arrest ang imuhang patient ani. Okay, digoxin is known to have a narrow therapeutic index. Kaya nga yun, 0.4. Okay? Because of its potential what? Fatal toxicity. Okay? Digoxin should be administered with caution. Okay? So, tandaan nyo yung formula, class, ha? Ma'am, mag-quiz na po kag formula. Isipin ko pa. Okay. So, the therapeutic range daw, or the therapeutic window for means that this is between the minimum effective concentration in the plasma and the minimum toxic concentration. Kaya yung 0.5, okay, 0.5 to 2, ito daw yung sa digoxin daw na ito yung pinaka-minimum effective at ito daw yung pinaka-minimum na toxic concentration niyang digoxin. Okay? So again, the peak drug level, this is the highest plasma concentration of drug at a specific time. It indicates the rate of absorption of the drugs. So yung peak natin, okay, it will identify whether our absorption is fast, as well as the metabolism is fast or slow. Okay, and the throw level is the lowest plasma concentration of drug and measures the rate at which the drug is eliminated. So, palabas na. Throw, throw, labay. O, throw, labay. Peak, mauna to siya ang absorption or ang pasaka. Makita ang effectiveness sa gamot. Okay? So, the peak and throw levels, okay, could be the determinants for the dosing interval of our medications, especially during therapeutic drug monitoring. Lalo na yung mga close monitoring natin ng mga patients, dito natin makikita yung this is the peak effect of this antibiotic. This is the throw level. So, dapat before this throw level or before this time that the antibiotic loses its potential effect in the system, dapat meron na tayong supplement or nakapagbigay na tayo. And remember, okay, always remember that absorption and metabolism are factors. Okay? Okay, are factors in what? In order for us to reach the peak drug level. Okay? And the throw level, ito na yung time kung saan our medications are being eliminated out of the body. Kasi nga, na-absorb na siya. And these are already undigested parts of the medication. Okay? So, ano yung mga factors na yon? Yung sa tawag nito, sa absorption natin, di ba? Kung yung route of administration, if IV, there is no more what? There is no more absorption and metabolism kasi systemically given na siya. But if it is in other routes, IM, sub-Q, and oral, yun na yung merong mas matagal na process before we can see the effectiveness of the medications in the system. Okay? So, that is all for the phases of our phases of our drug therapy. Okay? So, supposed to be, okay, suppose we have to continue, but I will just what? I will just give you what? A video na lang. Patanaw na lang tamo og video. Okay? Regarding our next, this is regarding our next, kasi we still have 15 minutes. Ay, kaya pa ni, 45 pa. Kaya pa? Ayo. Napa ko estudyante. Next time na, ma'am. Wow! Next time na, ma'am. O sige, dili na lang ko mag-discuss. But I will just show you, okay? I will just give you video na lang sa, ma'am. Lagi, magpa-video na lang ko. Okay? Magpa-video na lang ko sa ato ang next topic. Okay? Mauna niya tong next topic. So, pag andam-andam na lang. Okay? Kaya na ako'y pa-assignment sa inyo. Mag-assignment na po, ma'am. Sige na lang, good. Karong pag-matag assignment si ma'am. Sige. Watch na lang this one, ha?
Nearly each one of you has taken antibiotics in your life at least once. But what are antibiotics? How do they work? And
Sorry.
nearly each one of you has taken antibiotics in your life at least once. But what are antibiotics? How do they work? And what is antibiotic resistance? These questions will all be answered in this video. The target of this medication are microorganisms, more precisely bacteria. Once treated with the correct antibiotics, the bacterial infection is eliminated. In general, antibiotics do not function against viruses or fungi. Instead, they are specifically directed against bacteria. The first antibiotic was discovered by Sir Alexander Fleming in 1928. He observed a spot in his petri dish where bacteria did not grow around fungi. These fungi produced an antibacterial substance which killed the surrounding microbes. It is commonly known under the term penicillin, which would later save millions of lives. This discovery is often described as one of the greatest victories ever achieved over disease. How do antibiotics work? There are multiple types of antibiotics and also different mechanisms of action. Some antibiotics disrupt the cell membrane integrity. Others interfere with essential metabolic pathways or inhibit nucleic acid synthesis. Again, others inhibit protein or cell wall synthesis. Altogether, they have one in common. They target essential processes in the cell and prevent bacteria from spreading, either through killing them directly or inhibiting their growth. This video will demonstrate some of these mechanisms of action. One class of antibiotics inhibits the cell wall synthesis. The bacterium has a cell membrane and also a cell wall, which consists of peptidoglycan. These are sugar molecules interlinked with peptide bonds. More closely, a bacterial cell wall looks like this. Without the essential peptide bonds, the cell wall becomes extremely unstable. As a consequence, the cell can even burst due to the high osmotic pressure inside. But how is the cell wall synthesized? An enzyme called transpeptidase catalyzes the reaction necessary to cross-link peptidoglycan. This mechanism is the target of an antibiotic that we already know, penicillin. Penicillin belongs to the group of beta-lactams, and what they do is they inhibit the activity of the transpeptidase. No transpeptidase activity means no cell wall synthesis. The cell wall becomes unstable and bacteria are eliminated. Therefore, most antibiotics of the beta-lactam family are considered bactericidal. Since mammalian cells do not have any peptidoglycan, These antibiotics do not interfere with human cells. Other antibiotics can inhibit the protein synthesis. The bacterial mRNA needs to be translated into protein. Ribosomes are the responsible catalytic machinery of translation. They synthesize a polypeptide chain which will fold into protein. When we take a closer look at the bacterial ribosome, it consists of two subunits, the larger 50S and the small 30S subunit. Tetracycline is an antibiotic that interferes with the small 30S subunit. tRNAs can no longer bind to the ribosome and protein synthesis is inhibited. This does not directly kill the bacterium. However, it depletes them of protein required for growth. This mechanism is therefore considered bacteriostatic. How can this antibiotic specifically inhibit the translation of bacteria but does not interfere with our own protein synthesis program? Mammals, including humans, have different ribosomal subunits, a 60S and a 40S subunit. Upon medication, we can translate our mRNA without any problem. Some antibiotics target one step before translation. These subtypes can inhibit nucleic acid synthesis. The bacterial DNA is usually transcribed by an enzyme called RNA polymerase. It synthesizes mRNA in a process called transcription. An antibiotic called rifamycin can inhibit the enzyme activity of RNA polymerase. This will stop mRNA synthesis and with this indirectly also protein production. Rifamycin does not inhibit the mammalian RNA polymerase. Upon medication, nucleic acid synthesis is not affected in human cells. The use of antibiotics, such as penicillin, first became available during World War II. Numerous soldiers came into hospitals with infections after battle wounds, and the death rate was significantly reduced due to antibiotics. Antibiotics were therefore called wonder drugs. In summary, one can say that antibiotics revolutionized medicine. However, today they are heavily overused. Not only for humans, they are also administered to livestock, keeping the animals healthy and routinely prevent disease. Overusing antibiotics promotes antibiotic resistance. Antibiotic resistance is generally caused by simple mutations in the bacterial DNA. Mutations occur almost all the time in all organisms. But when an antibiotic is used and one microbe developed a resistance towards this drug caused by a random mutation, this drug becomes ineffective. Then, other antibiotics have to be taken into consideration. They might work, but again, the high selection pressure on the microbes might promote mutations which could lead to multiple drug resistance. In the worst case, no antibiotic would be effective anymore, and the result would be a supergerm, which might cause the next big pandemic. Multi-resistant microbes are already among us. To not draw a future too dark, let me tell you, science is permanently working on the problem by developing new antibiotics. However, we need to be more responsible with the use of antibiotics in the future. Thanks for watching. If this video was interesting and you
Okay. Hala, nawala na pud lagi ko. Buang lagi ni ako ang ay. Class, dili, makita pa ko ninyo, dili. Natabunan na siguro ko sa
Dili,
building
ma'am.
sa sakit.
Dili, ma'am.
Ay,
Ay, nakita
It's
na,
always
nakita na.
Sabi na ako, natabunan ako sa kanang building sa San Pedro. Okay. So, our discussion for next meeting will be antibiotics. Okay? So, just additional inputs. Okay? Antibiotics can be a form of bactericidal or bacteriostatic. So, your assignment is, okay, you are going to make a drug study. Kasi you sooner or later you will also do the same. Pero dili lang siya drug study na kanang parehas sa ginabuhat nato sa ato ang lahion nato siya. Kumbaga research type na tawag siya na. You are going to, for example, penicillin. What kind of what kind of medicine? Okay, ang imuhang specifically mapili. Okay? It could be di ba mag-penicillin ka. So unsa ang mga brand? Okay, unsa yung mga brand sa mga penicillin na gusto nimong himuong drug study? So penicillin, which is iyahang generic, the brand, okay? I want the mechanism of the action, okay? And then mechanism of action unsa ba? Is it bacteriostatic, okay? Is it cell wall inhibition? It could alter the membrane permeability or ano. I want you to do that one, and I want to see the side effects of this medication. And what is your nursing? Okay? What will be your nursing management if you are going to have patients who will administer this kind of medication? Again, antibiotic, the generic, of any, kahit ano na maisipan ninyo. Okay? Tapos, the mechanism of the action, the side effects, and your nursing management. Okay? I will be sending a G Drive link wherein you will submit your assignment that is part of your class standing. And then before, okay, next week, before we will have the lecture proper of antibiotics, I will be calling out one, okay, dili lang one, I will be calling someone, okay, some two, some three, depende sa ko ang mood, okay, depende. Ma'am, uy, mahadlok man tayo, mood ni mo, ma'am, uy, dili lang good mahadlok, okay, chillax, kaya ra na, okay, basta maning kamot lang, okay. So, I will be calling out someone to make what? Just a simple report. Okay, and then, of course, me and your classmates will ask some questions. That's why you have to know what is your drug study all about. Okay? So, send na ko sa ato ang GC, ang ato ang ang link na makreate na ko. Ma'am, ano po yung format ng assignment? What do you mean? Okay lang kung mag-same kasi wala man akong gi-specify talaga. Pero basi pod ang kay Jan, ang kay Christine, o ang kay Zarina. Oh, yes, Shan.
Hello, ma'am. Dagan ko question, ma'am. So, una ang deadline nito is next week po.
Oo, next week. So, di ba ang klase natin next week is Tuesday. So, dapat by Monday of next week, okay?
11:59.
Ha? Grabe, kung maka 11:59 specific. Oh, sige, basta Monday.
Monday mo na, ma'am.
Sure diha. Oh, sige, basta Monday before mag-strike ang alas 12 sa gabi, dapat na-submit sa ako ha? Sa drive. And then write your what? Write your family name first. Okay? Write your family name first. Dara dyan na ako makita. Kinsa yun, nagsunduganay. Dara, o ka nang nagcopy-paste lang silang mga classmate. Ha? Kusiun ko dyan ng mga gitik ninyo ba? Okay? Ano pang question, Shan? Meron pa?
I-remember sa nako ko pangutana.
Ay, naku. Na-miss siya. Nasa ba, Shan?
Kanang, di ba, asynchronous man tayo next week, ma'am?
Asynchronous. Actually,
Or wala sa mga NCM subjects?
Bitaw, no? Asynchronous man din ito. Wow!
Wala
Yawa,
assignment
oy. Huna-huna dito. Ma'am, dito magklase mo. Asynchronous good ma. Okay. Ako ang huna-huna. Okay? Kung sakali na i-check na ko ang ang kanang tawag ani, ang kanang ato ang ang ato ang schedule. Kasi nga, ang fear ko, kung ipa-asynchronous ko kayo, unsa ang guarantee nako na makasabot mo sa kani nga tambal ay kani nga lesson. Okay? Tapos 'di ba? wala na tayong format na i-follow. Okay, wala na format, wala na unsa na size sa bond paper, wala na kasi G drive lang naman, wala na fonts. Pero ayaw lang po na sobra kadako, ayaw po na sobra kagamay ha. Okay, kanang sakto ra na mabasa ra pod gyud nako, okay? Wala na kasi what I am after is the content of your research. Okay? So, wala na tayong format. Ngayon, kung sakali na limited po ba ang antibiotics or any lang po na drug, antibiotics lang muna tayo kasi antibiotic pa man ang ating topic. Okay? So, maraming klaseng antibiotics. Okay? So, kung magpare-pareho man mo, ay lang po sunduga ang answer, ay ang research ni kinsa ni Melanie og ni Gian lahi dapay kanang maskin gamay na aman lay wala na pud lagi ko kahadlok ba ani oy nawala na pud ko natabunan na pud ko sa building sige so yun siya ha, it does not mean padayon ako sa kung gibati ha magstorya ra ko dire okay kahit pa magkapare-pareho kay ng gamot siguro kahit pa paano meron naman niyang pinagkaiba, 'di ba? So, tingnan lang natin yan sa mga nursing management ninyo. Kasi hindi naman natin mabago yung mga mechanism of action, ganyan. Sa nursing management tayo magkakatalo. Okay? So ngayon, if it happens that we will be asynchronous by next week, so I will just give you a video recorded lecture about this one. Okay? Wala man ko'y choice. Okay? Dili naman ko ninyo patudloon, charot lang. Okay? So, gano'n na lang siya, ha? Ko lang muna, i-confirm ko. Kasi sa akin next week, meron kahit asynchronous kami ng schedule ng anatomy manggod. Mag face-to-face kami kasi nga we are running after of the time. Kasi nga malapit na yung exams. Okay? So, kayo manggod ang malugi kapag hindi kayo nakahabol sa lecture. Okay? Kay ang atin pa namang examination is hindi ako ang gagawa. Okay, alam niyo naman siguro yan, di ba? It is a collaboration of all pharma clinical instructors. Okay, hindi lang ako ang gagawa. So, hindi ko alam anong ilalagay nila na questions, and then for prelim, I am not assigned in making the questions. Okay, so yun lang din yun. But rest assured, okay, if ever man class na magkaroon tayo ng tawag nito asynchronous activity by next week, i-send ko na lang ang tawag nito, yung video ng pre-recorded natin. Okay? Tapos, but still, the assignment, I want it by 11:59 of Monday. Sabotable? Clear? Hala, wala na po sila naninyo.
Yes po, ma'am. Noted po.
Okay, Gorabel. Sige. So, yun lang ha. Huwag kakalimutan. Okay? So, can I have Grace? Grace, lead the prayer. Grace, closing prayer.
Okay po, ma'am. Wait lang. Okay, classmates, let us pray for the Catholics. In the name of the Father, the Son, the Holy Spirit. Amen. Lord, thank you for this wonderful day. Thank you for the successful class that we just had. Thank you for all the knowledge that Ma'am Katrina imparted to us, and thank you for giving us the opportunity to learn. And may you bless us as we proceed to our next class. In Jesus' name we pray, amen. Then the Father, the Son, the Holy Spirit.
Okay, class, you're dismissed. Thank you, Grace. Monday ha, assignment 11:59. Bye.
Thank you po, ma'am. Ingat po
Bye,
kayo.
Nerna.
Thank you po.